Good afternoon. Thank you for the witnesses being here today to discuss a crucial issue before us, investing in a healthier America, chronic disease prevention and treatment. Chronic diseases such as cancer, heart disease, and Alzheimer's cases are skyrocketing, according to the American Cancer Society. In the coming year, we're expected to hit a bleak milestone. The first time of new cases of cancer in the U.S. are expected to be across the 2 million mark. This daunting number tells me that we need to invest in technologies that will be able to catch these chronic diseases early and often. We have another growing challenge. Over 45% of the nation's adults are obese. It's hard to imagine that number, but that's what the number said. And the sadder part of that, over 20% of the nation's children are obese, 20% of the nation's children. For the sake of ourselves, our children, and our communities, we must do better. In fact, we are about to eclipse 19% of the GDP going towards health care expenditures, while Medicare just surpassed, first time, $1 trillion in history. In Israel, for example, they live five years longer than the average American and spend less than 8% of their GDP on health care. We need to learn from our neighbors and our friends about how to do a better job of it. Not that we don't do a lot of good things in terms of the health care space, but there's a lot more that can be done. Many families don't have the time or the resources to analyze and read the food labeling to understand what they are really putting in their bodies. That's why it's critical our nation's medical providers have to have the tools necessary to educate their parents on the importance of nutrition for them and, most importantly, for their children. To bring awareness to this issue, Congresswoman Glenn Moore and I recently launched the Congressional Prevention, Health, and Wellness Caucus. Our bipartisan group focuses on prevention, food is medicine, exercise, and doing what we can to get our military more ready. Effectively, the readiness for the military, I'd like to thank Congresswoman Moore for joining me in that critical initiative, and I urge my fellow members to take a look at the subcommittee as well. The obesity epidemic has also, as we talked about from a national security standpoint, according to the American Security Project's obesity rates among active duty service members. I went in when I was 18, so I know got some sense of it, but an active duty service member is double in the past decade as we face in terms of obesity. This growing threat from our adversaries across the globe. We cannot afford to have an unfit and unhealthy military to address major international dangers. Stocking in those that try to get in the military between 17 and 24, 1/3 of the adults are overweight and unable to serve in terms of the military. We are about to hear from a great group of folks, and I've followed these, especially the senator, for the last 30, 40 years. It's hard to believe, but I'm very excited about a great group of folks that we've got today that are on the front line of these chronic conditions, and ensuring prevention is the main priority in the medical field. As Senator Frist said in a recent article in Forbes, we all need to prioritize and going back to the very basics, and the food we put in our body is the key. I'm pleased to recognize the gentleman from Texas, Mr. Doggett, for his opening statement.
Well, thank you, Mr. Chairman. I know how passionate